Hi guys, this is Dr. Nick from Centra Family Chiropractic, and I just wanted to shoot a quick video today about a topic that I've been had a couple discussions with patients throughout the day, so I thought I'd share it with you guys as well. And the topic is on ear infections, and the statistics, like it says in the description there, show that roughly 80% of kids before the age of 3 will have a recurring ear infection or chronic ear infections. And when something like that in terms of your health becomes that prevalent to 80% of all kids are having something like that, then that becomes the new norm. Okay, and ear infections, they're looked at now as, oh, it's just something kids go through, or it's common, they'll grow out of it. And I just want to talk a little bit today about, number one, what really causes ear infections. And the cause of it is really that the ears have tubes, all right, and they're called the eustachian tubes. And the eustachian tubes have a little muscle that go around the tube. And within that tube, there's fluid, and then there should be fluid. And I know a lot of parents have, I'm sure if you've been doing research on ear infections, you've heard that, well, kids get ear infections because their tubes are more horizontal when they're an infant. And that is true, that the tubes are more horizontal, but that's not why kids get recurring ear infections. And the truth is that they were designed to be more horizontal when they were as an infant and as a baby, because babies spend most of their time on their back. So when you're on your back, they're more horizontal so they can drain better. So that's not the cause of ear infections. And what really is the cause is ear infections are a drainage issue. It's not a virus issue. It's not a bacterial issue. Simply because, and a lot of parents can kind of figure that out, because when they go through antibiotics and rounds of that, and they keep coming back, it becomes kind of common sense that, well, antibiotics aren't working. And the reason for that is because it's a drainage issue. So anyway, the tubes of the ears, eustachian tubes, they have a little muscle that goes around them. It's called the tensor valley palatini muscle. And just like every other muscle in our body, that muscle that surrounds the tubes is controlled by a nerve. All right. So if you've ever had a pinched nerve or an irritated nerve that created muscle tension and muscles to be spasm and so on, then you will know that if you have tension and stress on the nerves that control the tubes of the ear, which happen to be located in the upper neck area, then it's going to create the muscle to constrict, and that tube is going to pinch and clamp down. And when that happens, then the fluid in the ears are not able to drain properly. So it allows for that fluid to build up and set in there, kind of like if you've ever seen a pond that's stagnant, that doesn't have an inflow of new water, an overflow, then it gets gunk that kind of builds up on the top because there's no flow of water coming in or out. Same thing with the tubes in the ears, that when those tubes clamp down and they don't drain properly, that fluid just sits in there, and it allows for an easy place. Hey, Christy, how's it going? Allows for an easy area for that fluid to sit and settle, and that's when bacteria or virus can then build up, and that's when you get the infection. So when you go through the antibiotics and all those things, it'd be like dumping chlorine in a pool that doesn't have any filter that's filtering out the water. It's going to clear it up for a while, and then it's going to gunk back up. So as chiropractors, what we're concerned with is we check the stress on those nerves, which in most cases is due to the birth process with kids. That's when that first tension and stress starts, and that really is what clogs the drain, clogs those ears, clogs that all from draining properly, and that is what causes the ear infection. So the reason we have such good success with little kiddos and ear infections and things like that is because we are looking at what's creating that stress and tension that's clogging, preventing the body from draining properly. And when we find that and we fix that, now the body and the tubes can drain properly, and you don't have that backup to where bacteria and viruses can proliferate. So I just wanted to shoot a quick video on that. If you guys have any questions, thanks for tuning in. Just get a hold of us, call us, message us, email us, whatever it takes. We're here to help. So thanks for tuning in, and we'll talk to you guys soon. Thanks.